Premature ejaculation is one of the most commonly encountered issues in male sexual health. In general terms, it refers to the condition where a man ejaculates earlier than he or his partner would like, often either before sexual intercourse begins or shortly after it starts. The primary problem here is the inability to control ejaculation, leading to distress in both the individual and their partner. Premature ejaculation can damage self-esteem and cause stress, anxiety, and even distancing in relationships. The symptoms are quite clear. Ejaculation occurs very quickly during intercourse, often within 1 minute of vaginal penetration. The individual consistently feels unable to delay ejaculation, and this occurs in nearly all sexual encounters. Another significant symptom is the emotional distress, frustration, and sometimes relationship problems that arise from this lack of control. In some cases, even if the individual can exert some control for a short time, the anxiety about losing control can itself cause a sense of premature ejaculation. Therefore, it is not merely a physical issue. Emotional and psychological factors also play a major role when it comes to treatment. There are two main approaches: psychological, psychotherapeutic methods, and medical pharmacological therapies. Combining both typically yields the best results. It is important to understand that premature ejaculation can sometimes be triggered by psychological factors such as anxiety, stress, or depression. Therefore, sexual therapy and individual psychotherapy are crucial components. Sometimes, techniques used during intercourse, such as the squeeze technique or the start-stop method, aim to help individuals consciously retrain their ejaculation reflex over time. As for medication, there are several options available. One of the most commonly used drugs contains the active ingredient Dapoxetine. Dapoxetine is a short-acting selective serotonin reuptake inhibitor, SSRI. It's taken a few hours before sexual activity to significantly prolong the time to ejaculation. Additionally, traditional SSRI antidepressants, such as sertraline, paroxetine, or fluoxetine, which are used daily, can also have positive effects on premature ejaculation. However, these medications usually take several weeks of regular use to show their effects and should always be initiated under medical supervision. There are also local anesthetic creams or sprays that numb the penis slightly to delay ejaculation. However, improper use may reduce sexual pleasure or cause numbness in the partner, so caution is necessary. Moreover, lifestyle changes can also play a supportive role. Smoking, excessive alcohol consumption, poor diet, and a sedentary lifestyle can all negatively impact sexual health. Therefore, maintaining a healthy lifestyle may indirectly help alleviate premature ejaculation issues. Finally, it must be emphasized that individual differences are significant. A method that works very well for one person may not be equally effective for another. Therefore, if someone is experiencing this issue, the best course of action is to consult a urologist or a psychiatrist specialized in sexual dysfunctions to create a personalized treatment plan. Self-treatment attempts, especially inappropriate use of medication, can potentially worsen the problem.